In the UK, there are 100,000 hospital admissions every year due to heart attack. That's 290 a day and one every 5 minutes. Today, we're here at Bart's Heart Centre to meet a team who recently introduced social prescribing to support their cardiovascular patients. Research shows that cardiovascular disease and social deprivation are linked. Dr. Tara Mastracci is a surgeon at the centre, and she explains the role social prescribing has for these patients in a hospital setting.
The burden of cardiovascular disease has been proven to be higher in patients with deprivation in almost any jurisdiction that it's studied in. And I think we see that not only just in the burden of disease, but also in patient outcomes. So as a vascular surgeon, cardiovascular interventionalist, I notice that patients do more poorly if they're from more deprived backgrounds. It's quite frustrating for me and the team when we do everything we can as fairly and equally as possible, and yet patients just have some factors stacked against them. I like to think about social prescribing as a bridge between people's clinical and non-clinical needs. And so it is a way to offer support for patients who need health and well-being support that is potentially non-medical.
When someone experiences a heart attack and they go through Bart's Hospital, at their review with an advanced clinical practitioner, they'll be asked a social deprivation question. This question basically assesses whether they're having any financial difficulties, and if they say yes, they're then referred on to me. I then carry out an initial assessment of their needs, and then we work on a plan together. Aside from financial support, we would support people with access and physical exercise, connecting with housing so they can complete housing register applications, or put in medical needs assessments, or, as is the case with many of our patients, because of the trauma that they've experienced with the heart attack, I typically will connect them with a local talk and therapy service.
It isn't conventional that you would consider that you would have social prescribers within a hospital setting, but the benefits to your patients, to your wider population, and also just to how efficiently and more effectively you can run your hospital means that I would consider it one of the most kind of priority innovations that any hospital executive or senior leader should be considering, especially with the amount of evidence we now know around the importance of social deprivation to clinical outcomes and success of treatments.
The scheme at Bart's Health Centre is still new, but the early results have been really encouraging.
There's been this gap in being able to respond to patients' needs when they say that they have financial or social issues, and there's been no place to point them in the past. I hope that the future of social prescribing will be to show some economic benefit, to definitely improve the well-being of our patients, to increase people going for walks after heart attacks, which will hopefully decrease second heart attacks.
So I think social prescribing can have a huge impact for individual patients, for populations of patients, and also real material benefits for a hospital.